Hello, everyone. My name is Celso Arango. I'm professor of psychiatry at the University Complutense in Madrid and director of the Institute of Psychiatry and Mental Health at Hospital Gregorio Marañón, Madrid, Spain, and also member of the Royal Academy of Medicine in Spain. And it is my great pleasure to welcome you all to this FEAM Forum workshop on mental health in healthcare and veterinary professionals, organized by the Federation of European Academies of Medicine and the Federation of Veterinarians of Europe. And here we are talking about mental health as it happens every single day on the news and newspapers, on TV. I had the opportunity to be at the European Parliament yesterday talking about mental health and the global crisis that we're suffering. So it's everywhere, and I think for good reasons. And there was I think it was Oscar Wilde who said a long time ago that there is only one thing worse than people talking about you, and that is people not talking about you. And for and very sad reasons, the recent corona pandemic that we all suffered very recently. The reality is that mental health has become a major issue in Europe. We have to remind ourselves that what is happening now with mental health is not what happened with COVID, because some people tend to think that as it happened with COVID, that we didn't have any problem 3 years ago and it did not exist, and now there was an explosion happening with mental health, and that is not for sure the case. It's not the case, because mental health problems and conditions were very prevalent, and they were rising before the pandemic. And everything that the pandemic has done has been accelerating for most of the, for some of the conditions, mostly depression and anxiety. But the problem was already there, and we probably were not paying enough attention that it deserves. We have to remind ourselves that 1 in 6 people as of today will be suffering from a mental disorder, a mental condition, and that's a transversal. But if we take the lifetime account, it will be 1 in 4. So 25% of all European citizens will suffer from a mental disorder along their lives, and that is a lot. That is a lot of suffering. That involves a lot of people, including their families. Not only that, in the last 10 years, more than 500,000 people, more than 500,000 people committed suicide in Europe. And suicide, by the way, is the most common cause of death in many of our countries for adolescents. So it's a problem that many of us have been involved with in the last decades, that now finally has grasped everyone's attention, the general population attention, politicians' attention, and that's an opportunity that we have to take into account. We also know that mental problems do not affect the general population at the same level, and that has been made very, very clear after the COVID-19 pandemic. There are some vulnerable groups, and I had the opportunity to spend one day yesterday with Mary Walsh, who is the co-chair of the European Union Group on Mental Health and Well-being, discussing what are those most vulnerable groups, including children, adolescents, including women, including migrants, including those at low socioeconomic level, but also including professionals of health professionals and veterinary professionals. And again, that was made very clear after the pandemic and all the burnout that we suffer. But as it happened with mental health, and we have to remind ourselves again that these problems of burnout and increased rate of suicide or increased rate of many of the mental disorders was already present before the COVID-19 pandemic in health professionals and veterinary professionals. So here we are to have a really dynamic and lively discussion with lots of experts from many different multidisciplinary areas, and the way this is going to work for the next 85 minutes is that we're going to have 2 sessions, 2 talks. Then we will have a panel discussions with 5 more new invited panelists, and then we'll have an overall discussion in which we hope that you can participate. And you can do so by sending us questions through the chat. So I'll be checking on questions that we receive throughout the whole meeting through the chat, and then we will have the opportunity to discuss them with the whole panel. And without any further delay, it is my great pleasure to introduce the first of the two speakers that we have today, who is Professor Jean-Pierre Michel. He's a full professor of medicine at Geneva University Medical School and has a geriatric ward at the Geneva University Hospitals in Switzerland. He co-founded the Interdisciplinary Gerontology Center at Geneva University and the European Academy for Medicine and Aging. He is honorary professor of medicine in Limoges University in France, Beijing University Hospital in China, and adjunct professor at McGill's University in Canada. Moreover, he is fellow of the Royal British College of Physicians in London and the Royal College of Physicians and Surgeons of Glasgow. And he has numerous awards, and he will be presenting the mental health of healthcare and veterinary professional. Professor Michel, the floor is yours.
Thank you very much, Professor Arango. It was a very nice introduction, and I feel old and old when you are saying all what you said about me. So my pleasure to be with you today to speak about mental health of healthcare and veterinary professional. As you said perfectly, Professor Arango, I think that mental health problems existed long before the COVID pandemic. And there was a lot of difference in Europe between a region, social, gender, and age inequities. But I think what is important to stress at the beginning, it is also a very costly problem, which was estimated before the COVID pandemic to 600 billion per year. So,
Jean-Pierre, 1 second. Can you please put the presentation mode so we can see the whole slide rather than your desktop?
I will try to do it, but it was done, I think.
Okay.
I did it.
Because we're seeing your first slide.
Yes, but I have to restart, I think. I have to restart probably my presentation.
Well, this is presentation mode now.
It is presentation mode now?
Yeah, we can see. No, not now. Sorry about this.
I try to do it, but does not work.
It's not working. But anyway, I think we can see the slides, so you can we can see the slides.
Very sorry.
And we don't see anything that we should not be seeing. So.
Okay. Would you like me to restart, or?
But just go ahead. See if can you pass the slides?
Yeah.
No. Yeah.
Full screen. I am very sorry, but it does not work. At the bottom on the right, does not work.
Right. Never mind. We can see the slides. Thanks.
Okay. So I said that, as you mentioned perfectly, Professor Arango, the mental health problem existed long before the COVID pandemic. I think that it's very important to notice that, and it was extremely costly. And when we are thinking about the workplace, I think that in Europe, 27% of workers have reported experiencing work-related stress, depression, and anxiety before the previous year, which indeed changed completely or increase the risk of absenteeism, decrease life being, and although modify completely the business and industrial organization. So if I have a problem with my slide, I can say that. So when you are thinking about, I have really a problem.
We can see slide number 3 now.
Okay. When we are discussing about mental health, I think that it's very important to say that mental health is a state of well-being that enables people to cope with the stresses of life, realize their ability, learn well and work well, and to contribute to their community. And today we will focus about the healthcare workers. And when we are speaking about healthcare workers, we are speaking about a lot of categories of professionals: nurses, physicians, allied professional, veterinarian, but also people who are involved in the supportive role in the healthcare system and the community health worker. I think that these health professionals are representing the heart of the healthcare system. And as they are representing the heart of the healthcare system, they have moral injury, compassional fatigue, anxiety disorders, burnout, and it appears that all these symptoms are linked to three main stressors: psychological stressors, organizational stressors, and environmental stressors. When you are looking at the stressors, I will not detail them until now, but I think that they have a very important impact on altering the mental health of healthcare professionals, but also, and we have not to forget it, they are decreasing the healthcare performances. With the COVID pandemic, everything changed and increased. As you said, Professor Arango, the psychological stresses increase a lot with the local life imbalance, with the fear of being infected. And the environmental stresses are also increased with exposure to infected patient animals, to the absence of virus, physical environment, a free physical environment, to inadequate personal protective equipment. And at the organizational level, it was the lack of healthcare professionals, which was noticed by WHO long time ago, with a workplace harassment, unclear workplace policy, poor human resources and management. So the result of this lack of healthcare professional linked to the lack of care of the population during the COVID pandemic increased a lot of problems. And it was the problem of postponing the treatment of health, the poor management of chronic condition, the disruption of diet, exercise, drug regimen, the postponement of screening, and the postponement of other preventative health measures. And the result of this, all these things, with months of resource triage, economic torpor, social distancing, increase the anxiety of the whole population of healthcare workers, but also aggrave the pre-existing mental health issue. So after that, we have a main problem, which is in fact the healthcare professional incentives. The incentives of their own safety, anxiety concerning the safety of the loved one, the sadness linked to the co-worker death, and the fact that they have to work too many hours, and they are always have in mind, and they are worried about their own personal home supplies. More than that, and it is very important to stress it, they have a lot of lack of information regarding the infection risk, a lack of personal protective equipment, and rapid changing of guidelines and protocol with, at the beginning of the pandemic, the absence of effective treatment. So the results of all these problems are the fact that the healthcare workers who are in not enough, who have a lot of burden, have physical symptoms, physical fatigue, compassional fatigue, emotional exhaustion, isolation, moral distress, traumatic stress disorders. And it was particularly true for women with extra family charges and for healthcare workers of color. And the result of all these things are the bullying, the harassment, the stress, the violence, physical violence, and online violence. And the results, the symptoms that were analyzed in this very big meta-analysis, you can see that insomnia and sleep disorders are very prevalent, as well as anxiety symptoms, depressive symptoms, post-traumatic symptoms, but the most important is that all these symptoms are very often combined, and the overall well-being decreases a lot, which is very significant. So the main problem is that this kind of mental health issues concern all the healthcare professionals during the COVID pandemics. And you can see here that all of the professionals, whatever their activities, are suffering for this kind of problem. Sometimes, for example, the student more about anxieties, but the nurse are affected by all these kind of problems, and as well as the veterinarian. So the result of this kind of problems are in fact burnout. Burnout is described as a prolonged, unresolvable stress at work caused by chronic mismatch between the increased demand of the job and the limited resources of the workers. And on the right side of the slide, you can see that burnout before the COVID pandemic in the States shows that this kind of burnout exists in all the categories of healthcare professionals. And what we have to notice is that this kind of burnout now lead to the fact that a lot of healthcare professionals would like to leave their profession. And for example, 20% of the MD in the state would like to leave the profession. Nurses, 40%, veterinarian, 40%. And indeed, before the end of the survey, the employees of a public health department, 20% of them leave up the profession, and 50% would like to do it. So the main issue is, in fact, how to address mental health needs among the frontline healthcare professionals. And this is a crucial issue. At the European level, for all the citizens, but particularly for the healthcare professional, it seems that the principles are to firstly have access to adequate and effective prevention, but also to have access to high quality and affordable health care and treatment. Then the most important thing is to be able to reintegrate into the societies the healthcare profession who suffered from the healthcare mental problem, the health mental problem. So addressing the mental health needs, firstly, for the critical frontline workers to distinguish between psychiatric illness and normative distress. And this has to be done by a psychiatrist or by a trained physician. And indeed, depending on the diagnosis, to assure supportive care intervention and to provide resources. And these interventions may include psychological first aid, individual and group counseling, broadening the pool of frontline workers. What is also important and very important is to assure availabilities, accessibilities, confidentiality in the healthcare system. That is to say, encourage access to mental health resources for all healthcare professionals, reduce all stigma and barriers to disclose mental health issues, and to ban punitive and unnecessary action against care professionals seeking for mental services. But what is important to stress, and it was something that was really appeared during the COVID pandemic, is that the direct psychological support is not the only element of the solution. And what is important also is to have social and practical support as well expressed by this healthcare worker who look for provision of food, who look for more flexibility around the work, who look for clear communication, and also being consulted during their need. So what is important to say and to think when you are looking at the future is firstly to create and sustain a positive work and learning environment. And for this, to establish an equity, just and trust work climate. Secondly, to institutional well-being as a long-term value for all healthcare professionals. Thirdly, to address compliance, policy barrier for daily work, and particularly to focus on patient qualities of care. And to last, engage and effective and friendly technology tools, particularly to improve communication between the healthcare professional, but between also the providers and the patient. How to conclude this short summary? I think that we know a lot of things, and Gert said something very important. Knowing is not enough. We must apply. Willing is not enough. We must do. I think that it will be a very nice conclusion of this talk. I thank you very much for your attention. I am very sorry if you don't see my slide in full screen. Thanks so much.
No worries. Thank you very much, Jean-Pierre. And I could not agree with you more with that take-home message. No, it is time for action, and tomorrow will be too late. So, without any further ado, let me introduce our second speaker, who is Tricia Colville, and she from the UK. And she's the working group chair on mental well-being by the Federation of Veterinarians of Europe, FVE, and FECAVA and IPSA. She qualified from Glasgow University Veterinary School, and she completed a master's in business administration and is the past president of the British Small Animal Veterinary Association. She's currently business developmental director with Vets Now, which is the UK's leading provider of pet emergency care. So, Tricia, the floor is yours.
Thank you very much, Professor Arango, and welcome everyone. Delighted to be here to talk about this really important topic. I think, Elisa, could my slides go on to full mode, please? It's not on presentation mode.
Yeah, we're experiencing the same.
I'm going to share it now.
Thank you.
Can you see it?
No, we still see not the presentation mode, but all.
I think that there was a problem.
Yeah, maybe there is. In which case, we'll just.
I try again, perhaps. Now?
Now, yes.
Yeah.
But you're on your third slide,
If
not the
you
first
can
one.
go back one, that would be lovely. But if not, I can go from here. It's fine, actually, Elisa. Let's just I'll just carry on. So, thank you very much, as I said, for the introduction. I'm very honoured and delighted that I am chairing the FVE working group on mental well-being and diversity, equity, and inclusiveness within the veterinary profession. It's a new working group that has been set up, and it's really just important that we strengthen the well-being within the veterinary profession, because it really is one of the key elements to really fostering recruitment, retention within the profession. So very similar that you were alluding to as well, Professor Michelle, in your talk about the human healthcare sector. Just a wee bit of background around FVE. So FVE is the Federation of Veterinarians of Europe, and it represents over 300,000 veterinarians. And the way it works is by representing through the veterinary associations across all of Europe, throughout 38 countries. And it does that through the 4 sections. So it represents practitioners. It also represents through the other 3 sections, which is state officers, the food and safety and veterinary health officers, and those working in education, research and industry. So next slide, please, Elisa. I think it's important here just to touch really on the culture within the veterinary profession and probably actually the culture within healthcare in general. And by culture, I mean really the shared and fundamental beliefs and values that we hold as individuals working within this area of healthcare. And the veterinary profession offers multifaceted and ambitious careers, requiring really highly flexible and resilient professionals. And while recognizing the abundantly positive aspects of the work that we do as veterinary professionals, the challenging social, economic, and cultural working climates has really been recognized as a source of veterinary mental well-being issues. So very similar to some of the topics that were being highlighted by Professor Michelle ahead of me. And the veterinary culture manifests in symbols such as role models. So if we talk about the late Dr. James Herriot, who I'm sure many of you will have heard of through movies and books, through the traditional models, so the veterinary oath that we all take as we graduate and move into our working world. And importantly, those tacit assumptions. And by that, I mean the unwritten rule that veterinarians should always prioritize the best interests of the patient over financial or logistical concerns. And this really reveals that culture there is almost an expectation for veterinarians to be superheroes, to be impervious to stress and fatigue, or beliefs that personal health is subservient to work. Next slide, please, Elisa. So this cognitive dissonance really manifests in practice organizational structures, in policies and in unspoken expectations. And as I said, whilst it's important to recognise the hugely positive aspects within the different domains of the veterinary profession, there are challenges, and we've highlighted a number of those challenges on the slide that we have here. It's really worth noting as well, just picking up on something actually that Professor Michelle noted, was around some of the information, some of the research that's coming out of the States. And the recent publication in the States noted a real lack of diversity, equity, and inclusiveness within the veterinary profession is frequently reported as a stressor in both the UK and the US. The veterinary profession in the US was the least racially diverse of all professions in the US, consisting of just under 94% white non-Hispanics compared to a lot of other professions and areas of work. Next slide, please. So FEE's really been investigating the mental health of veterinarians across Europe through two cross-sectional surveys that were carried out in 2018, the first one, and then more recently in 2022. And the first survey in 2018 had just over 14,500 participants taking place, veterinarians across the profession. And in the 2022 research, there was just over 12,000 participants. Now, across both of those surveys, mental health was decreased. Self-reported stress levels were consistently high within the profession, and there was a need for medical leave from work due to impaired mental well-being. And in total, 23% of all veterinarians answering the survey in both 2018 and 2022 had to take more than 2 weeks off work due to burnout, exhaustion, compassion fatigue, or depression over the last 3 years. It's remained consistent over the two surveys as well that there are more female veterinarians reported taking medical leave than male veterinarians, and early career veterinarians more than senior veterinarians. And I think again that relates very clearly to the research that Professor Michelle just talked around some of the gender differentials. But what's slightly different, I think, that's coming out in the research is there hasn't been a huge shift in this survey between sort of pre-pandemic, so pre-COVID versus post-COVID, which seems to be slightly different actually than we're seeing in the human healthcare that Professor Michelle mentioned. Next slide, please. Okay, and I'm hoping that this will work. It's just a very short video that we prepared as part of the mental wellbeing, diversity, equity, inclusiveness. So hopefully if we play this, it's just a short video. I'm not sure if the sound's going to come through. Let's just carry on actually, Elisa, if the sound's not going to come through, even though we practiced it earlier. Shall we just move to the next slide if that's possible? Although everyone can read what's coming up on the slides. Perfect, that's lovely, thank you. So just continuing on, and we'll you can have a look. That video is on FVE's website, so please do have a look at it there. But I just want to take you through this roadmap just very briefly in the last couple of minutes that we have. So FVE did and always will demonstrate an openness to new groups and to changes within the profession. And as I said, we undertook the research in 2018, and that's really led then to this first step in 2021, which was really mapping out mental well-being and DEI activities across the profession. And this really set that focus on diversity into motion. And we're really lucky within FVE because it benefits from the trust of our members. And members really can input into our understanding of what's going on, but also with the resources that we share, it allows each and every one to go at their own pace while perfectly communicating externally on the challenges and the opportunities to accelerate and amplify the curiosity about diversity and how actually that's really key to the mental well-being within the profession. So as I said, we undertook some mapping that took the form of surveys, interviews and webinars, and a report was launched in 2022. Next slide, please. Now, this Venn diagram shows the programs that were identified from that 2021 research, and the ones that were really most important to be implemented both by veterinary organisations, so the circle on the left, and the clinics, the circle on the right. And this was really based, as I said, on that survey, the interviews and the webinars. So a really diverse input of data, facts, and how our teams were feeling on the ground. It really highlighted that activities such as helplines were really perceived as having the highest impact on mental well-being. Webinars were universally stated as being very effective in creating awareness and having a huge impact, but were the least implemented by groups at risk. So it is important to implement strategies to increase that focus on mental well-being and DEI awareness. And this must reach all veterinarians at all levels of their professional career. And in general, interventions should be undertaken by both veterinary workplaces and veterinary organisations to be most effective. And I think that piece around the veterinary workplaces is really key because it's about you as an individual taking control and understanding your own mental health and well-being, but we need to have an understanding that the correct workplace is required to support that as well. Next slide, please. And then just really the conclusion is that openness to mental well-being and DEI issues is a prerequisite for a thriving and sustainable profession. And attention to veterinary mental well-being has really increased substantially in the last decade, but it's really important that we reach all veterinarians in all aspects of their career. And as I mentioned a moment ago, focusing in as well on good workplaces, that's really important. So for that, where you go the extra mile to create an inclusive and a positive workplace for their team. But more research is really needed to design an objective, universal applicable scoring scheme, because there isn't one at the moment. And a lot of the research will use different scoring. So sometimes it makes it really hard to be able to compare some of the research that's coming out. But fundamentally, mental well-being and DEI should be seen as a wider perspective, and a change will also be needed in the veterinary work culture and the environment so that professionals can thrive in the profession. So next slide. Really just to take us up to where we are just now in 2026, where we have a project, a 3-year project, which I talked about at the start. I'm delighted to say that I'm chairing, and that's really focusing in on the outputs of the research, the surveys and the webinars, and actually what are we going to do about it. Next slide, please. And from that, the main focus from the working group is we're setting up two projects. One is about Vet for a Day, which is really targeting secondary schools before the intake into the veterinary profession, before we go into the veterinary undergraduate degree, to make sure that we've got real diversity of all of the social, economic areas represented within the profession. And then the other one, as I said, really looking at the veterinary workplace to make sure that that is supportive. So I will finish there and thank you very much.
Thank you very much, Tricia, for this short, but then at the same time, very clear and very informative presentation. And we'll have the opportunity to discuss some questions at the end. By the way, there was a very specific question by Nina Struss. She was interested in knowing the reference for the American paper that you cited. So maybe you can write that in the chat so she can have access to the paper. And it's time now to go to the panel discussion, and we're very fortunate that we have 5 excellent panelists that with a very diverse but at the same time complementary background on the topic of the forum workshop that we have today. And the first of our panelists will be Katarzyna Tak-Bufkins, and she is a policy officer at Directorate General for Health and Food Safety at the European Commission. So Katarzyna, the floor is yours.
Thank you very much, Professor Arango. Good morning to everybody. I am very, very happy and delighted to join this seminar today. I learned a lot through these excellent presentations, and it's my great pleasure to share a little bit with you our insights about this very critical and important policy issue. So I represent the unit working on the state of health in the EU. So this unit is responsible for giving some kind of guidance and recommendations to member states on how the health systems could be improved. Of course, the health workforce is the beating heart of every health system. That's why we take all the challenges related to health workforce as something very central to our work. I share very much the call for action from Professor Michel. We fully agree that we know so much about the challenges. We know that all these challenges are not new, that the COVID pandemic just highlighted the scope and the severeness of many of these challenges, accumulated problems related to persisting shortages of healthcare professionals, but also yes, the working conditions, yes, the very hard working conditions, which were so much exposed by the pandemic. We see very much that all these professions where we see the biggest shortages on the labor market, and the healthcare is actually one of the critical ones. We see a very big job strain. We calculated this job strain, and we see that, for example, nurses have twice as high job strain than other professionals on the labor market. Doctors, 43% of them struggle from a very high job strain. So we know that there are many challenges. And yeah, given these challenges, we took recently some actions to help member states address some of these critical bottlenecks. We cannot solve all the problems, of course. You may know that the responsibility for health systems is actually the responsibility of member states. So these are the member states who decide how health systems are organized, how the service delivery is organized, and how many resources are put to the health systems. At our level, we identified the issues which are cross-cutting for all the member states, and we put in place some of actions which should actually help them to address the critical challenges of shortages and skills mismatches. This is the focus of our new actions. So I will just mention them briefly. If there is any interest in any of them, I can always provide you more information later on or after this seminar. So the first action, which is the most advanced, is actually helping member states to find the solutions to the problems of shortages of staff in the so-called medical desert. So these are the areas which are less attractive for people to work, less attractive for doctors, nurses, or the health professionals to install the practice. And we look at the whole range of incentives which should be put in place, and they may be very different because medical deserts in Europe are very different. You cannot always compare them. There are different challenges everywhere, but we put in place this action to actually mobilize the efforts to ensure that this is taken into account into the policies on shortages of health professionals. Another initiative which is ongoing looks at how we could improve the policies to retain health workers. So we saw from the presentations that there is a tendency to leave the professions. Yes, there is a big problem of burnout. So we certainly have to prioritize this kind of policies and approaches which will help us retain health workers. Another initiative is about task shifting. The idea is to make the best use of the skills and competencies we have in healthcare. So this is about, of course, working in teams between doctors and nurses, helping each other, trying to see what is the better way of delivering services to patients. Can we somehow combine the skills we have? Can we better use the skills we have to deliver the healthcare? And that could also alleviate the big pressure on health workers, actually. Another big initiative will help, which is called the Joint Action Heroes, will actually help member states to improve the health workforce planning methods. So this has been the ongoing job for many years, but this time the new joint action will help member states to build administrative capacities to really use these tools in practice. Of course, we have to improve a lot. We don't have good data on health workforce. We still have a huge actually policy evidence gaps. So we need this data to have a better input to our policies. This is also the objective of this joint action. We need to improve the data, and we need to make a good use of this data so the member states can forecast better the size of the health workforce they need to deliver health services. Then we have big actions on skills. One of them is actually part of the big Commission portfolio, which is called the Skills Agenda. So we created a skills partnership, which brings together all the interested partners who actually are helping us to mobilize efforts to put more priority to training and skills in health workforce. And along this initiative, which will create a strategy of skills for health professionals in 2 years' time. The work is very well advanced, of course. This is a collaborative process. There will be the public consultations launch of next year. This initiative is in particular looking at the new skills we need. We know very well that, the education systems don't always catch up with the quick developments, technological developments, societal developments. Why we need to align actually the education systems, the training mechanism we have, lifelong learning mechanism we have to equip and help health workers to get the right skills, the skills they need, to also ensure that they make a use of the new tools which are available to deliver better care, to actually reduce their the work burden related to administrative part side of the work. So we want them to have more time for their clinical responsibilities. That's why we put more emphasis on skills such as digital skills, but also green skills. And along this initiative, we launched a big training initiative under the EU for Health program, which actually is a big experiment on how we can improve the digital skills of health workers. So we have 7 big Europe-wide initiatives which have just started, and they provide the opportunity for health workers to benefit from such training. I would like also to mention something very, very important, the initiative on mental health. The Professor Michel already referred to it. And I think, yes, that this is also the result of this call for action, because we are all very much aware of the mental health crisis. And actually, this initiative comes as one of the critical pillars of the European Health Union. So this is already in place, and this is the effort which shows that we are committed to implement 20 flagship initiatives. We have a specific budget attached to it. And there are also some initiatives which actually target health professionals. So we just started a big call for action of 9 million, which would actually provide a program of multidisciplinary training and exchange for health professionals and other professionals working in the community with specific groups, with the focus on mental health, of course. There is also another initiative of 11 million euro, which we run with the WHO, which will actually assess what are the critical gaps in health system when it comes to the access to mental health. But WHO will also run a specific survey on the mental health of health workers. So I think it will be very useful, and we are looking forward to see the results of it.
Katarzyna, we should be finishing to have time for the other panelists, if that is fine with you. I mean, we are overwhelmed with everything that the Commission is doing, and I think we should be very, very proud. And after the President's announcement, we were also very positive and optimistic about this announcement in June on the comprehensive approach to mental health. Now it's, as you mentioned, it is for the states to listen and to implement all those recommendations. But we'll have more time to discuss about all these initiatives. And with that, I will give the word to Katerina Drakos from Global Mental Health, representative of the European Parliament. So we'll have 3-4 minutes for initial introduction, and then we will go for the overall panel discussion. Thank you, Katerina.
Yes, thank you so much. So unfortunately, MEP Sada Serdes could not be present with us today, but myself as a medical doctor and also global mental health graduate, I have been working very closely with her on this issue. And it is a big issue, as Professor Michel mentioned before. So at the workplace, and this data is from 2022, 27% of EU workers have reported experience work-related stress, depression, or anxiety during the previous 12 months. And this data really is shocking, especially when 60% of healthcare workers, or almost 60%, have low overall well-being, over 60% have insomnia or sleep disturbances, and over 70% have anxiety symptoms. So this is the data. That was very interesting presentation from Professor Michel, and it is a worrying situation. And we can see that the current system as it is therefore not treating mental health of our workforce as a priority. And we know that the mental health conditions are linked with risk factors in the workplace. And we know that these are included in the International Labour Organization's list of occupational diseases. And so from the European Parliament's perspective, we wonder why they are not included in the revised 2022 recommendation concerning the European schedule of occupational diseases. So here, good mental health includes paying attention to how the workplace is organized, how interpersonal relationships in the work environment function. And so we aim to prevent cases such as absenteeism, presenteeism, work-related stress, burnout, violence, bullying and sexual harassment in the workplace, fatigue, psychological burdens, among others. And since we've heard that healthcare workers have additional risk factors, this context and this data should be then the starting point for European discussions. And so Katarzyna has already mentioned how the Commission's comprehensive approach to mental health resurfaced after a conference on the future of Europe, and a proposal for further action by the citizens was mentioned. And so here the European Parliament listened to this call as well and responded with their own initiative mental health report. And so from the European Parliament's perspective, we do feel that it is insufficient to have flagship initiatives which indirectly address the issue. So MEP Sara Serdes is the rapporteur of the own initiative report on mental health, which will be voted soon. So what do we call for further action from the European Parliament? So we believe that in member states, there should be tools dedicated to identifying and addressing psychological needs of workers through occupational medicine. And Ms. Colville has already mentioned a little bit about this in her presentation. And we do feel the need for further research on the impact of, for example, teleworking, and also for the Commission to put forward a directive implementing the 2022-2024 work program concerning teleworking and the right to disconnect. Then it's very important the adoption of the reduction to work guidelines for people with mental health conditions, and also to reduce psychosocial risk factors at work. And here we could have prioritization of workers' rights, including compensation and social benefits. Additionally, maybe a review on the European Frameworks Directive on Safety and Health at Work. And as we mentioned before, revision of the 2022 recommendation concerning the schedule of occupational diseases. And here it's very important that we include work-related mental health conditions, depression, burnout, anxiety, stress. And so this is very, very key, as the member states can recognize mental health conditions, can recognize psychological stress as a multifactorial consequence of the environment, including the workplace. And since we know that obviously there are additional factors with the healthcare workers, we would like to see facilitated support, mental health services, accessibility for this mental health services. So here the message we would like to leave, and the European Parliament's position is that the bottom line here is that without caring for the mental health of the healthcare workers, we cannot care for the health of the population as a whole. So it's very important to invest in prevention and to invest in supporting people with mental health conditions related to the workplace. And thank you so much. I'm very glad to be here.
Thank you very much, Katerina. It was a clear message. And you were talking about job strain as a risk factor for many mental conditions, and you know, I could not think of anyone better to further discuss about job strain that the person who represents nursing, and those of us who worked in hospital know that this is a special, vulnerable collective of, you know, of professionals. And for that we have Paul de Raaf, who is Secretary General at the European Federation of Nurses Association. And you know, nursing is so important that at some point in time we were seeing you twice, but now you see only one. So I guess you're connected, right, Paul? You hear me?
Yes, but I think, do you hear me?
Yes, perfectly well.
Okay, can I start? Because the connection is very bad, going in and going out.
Okay, go ahead, and if we have any problems, I'll tell you.
So I think I can be very short, Celso, in the sense that WHO and the Commission are doing many things, for sure, but not the right things. Or nurses are leaving the profession, 30% left the profession in 23. So that the entire healthcare system in the EU is a medical desert. The entire system is going to collapse. Nurses left. They are not planning to leave, but they left already. Or nursing students, 20% left already. So the Commission and WHO need to re-evaluate all their actions, because it is not a ticking bomb anymore. It is a bomb that exploded already. And we are going to face major challenges, closing down nursing units, closing down hospitals, because there are no nurses anymore. So in that sense, the Commission cannot hide behind the principle of subsidiarity anymore. It's impossible, because in all EU member states, all of them, in all my members from EFN, minimum 10,000 nurses got out of the profession already up till today. Everywhere, minimum 10,000. In Finland, in Sweden, in Spain, in the UK, 50,000 left. So that is the key issue. The key issue is that we need to focus on creating domestic nurses, high quality nurses, qualified nurses domestically, not recruiting from India, from Pakistan, and all these countries. The second thing is we need to make sure that the nursing students stay in the bachelor. And that all links to one issue, what von der Leyen needs to do immediately, that is finance nursing profession to stay in the profession. Not next year, tomorrow. Otherwise, we close down hospitals. So, Sesto, that's from my perspective. I'm going to close down here and give an opportunity to the other panelists.
Thank you very much. And you made yourself very clear and loud and deliver a clear message. And I thank you a lot, because you follow my instructions to have a lively discussion. I'm sure it's going to be a lively discussion, but I guess no one here in this audience or anywhere could foresee a future of a health system without good nursing and good nurses and professional nurses. And it is really sad to see that they are completely burnt out, and that it's taking them to leave their profession. And I know that in countries, some countries that you mentioned, UK, only 1 in every 4 nurse is from the UK, and the rest are from outside Europe, which is something that which does not speak much or good about ourselves. So thank you very much, Paul. And it's time now to listen from Despoina Yatrido. She's a senior veterinary police officer from the Federation of Veterinarians of Europe. So Despoina.
Oh, thank you very much for the introduction. I have to say that I'm also a veterinarian myself, and I would like to bring my perspective in here. Actually, what I have heard so far, it really brings me back to the time that I have been myself in practice. So this is really a One Health issue, and it really have the similar causes and root that cause all these stressors, because there are I'm looking at them in a kind of categorization, like stressors that are related to the nature of the work, like, for example, the fact that we have to cope with patients, we have to cope with difficult cases. This requires physical and emotional efforts. We have to handle loss many times. We don't have a successful outcome. We have to handle the relatives or the owners when it comes to veterinarians. So not only the patient itself, but also wider emotions. We have to cope with issues of obedience or not of our patients. So there are a lot of stressors due to the nature of our healthcare work. There are also other kind of stressors related to professional matters and let's say relationship with the colleagues, like, for example, the management of conflicts. You have to see how to deal with different opinions on certain cases. You have to deal with unprofessional relationships. Sometimes someone has a different opinion about yours and how it is communicated to the patient, how it is communicated to the family. We have to deal with harassment cases, it was mentioned, or with different interests also. So all those are parts of our daily praxis. And then it comes to other, let's say, stressors, which are very important, like the work-life balance. We all know that our professions require to stay long hours in our practices, sometimes extending our stay in work. We have to handle emergencies. We have to be on call out of the normal hours. So all these are important stressors that also come in conflict with family life many times. And this we see it very much with the kind of with the females. It was mentioned that they find it more difficult many times to cope with this, and we have a big drop-off rates also to our profession, but also to the medical doctors. So we have really to look at this and see what we can do. And a lot of support initiatives have been mentioned, and it's important that there are there to be able to address all these situations, but we have also to look at the prevention. And one important element for prevention is to invest in education, and especially One Health interdisciplinary education. I was very glad to hear about the actions from the Commission, and also to see that many of them they refer to multidisciplinary training and activities to bring the teams together. I would suggest to make it also intersectoral training. So bring all of us together, because by sharing these experiences, it makes us understand that we are not alone. it happens to someone else. It's not only the healthcare professionals that they have this burden, they are the veterinary professionals that they have this burden. And we all together care about public health, that it comes to the fact of what was mentioned, that if we cannot care about ourselves, we cannot care about public health, how to do it. And when we care about human and animal health, it's all together that we care for the society. That's a sort of input from my part. Thank you again.
Thank you very much, Despoina, for that also clear message. And last but not least, we will hear from Jose Luis Gomez. He is a VP Public Policy and Advocacy for Europe, Middle East, and Africa from Bennington Dickinson, and he's also affiliated to University Complutense in Madrid. So, Jose Luis, the floor is yours.
Thank you, Celso. So for me, it's as well a great pleasure to participate in this panel. So, well, it is clear that there is a crisis, a workforce crisis in Europe. One of the drivers that it was mentioned is the shortage of healthcare professionals. The estimation is around 1 million shortage of healthcare professionals in Europe. So what are the implications? You mentioned that already. I mean, first, for healthcare professionals, this means work overload, overtime, chronic fatigue, burnout, and mental health problems. But as you know, the patients are paying the price as well in terms of longer waiting times. I think Dr. Michel was talking about that, especially in cancer. This is very important. Early diagnosis and treatment is correlated with survival rate. So this is an important element. But the other one is patient safety. As you know, when healthcare professionals are suffering burnout or chronic fatigue, or they are working overtime, the risk of errors is increasing exponentially. Some studies suggest that, for example, when nurses are working overtime, the risk of errors increase up to 30%. And this is a serious problem. I mean, OECD and other organizations has published some reports. One of them is saying that deaths coming from medication errors in hospitals are bigger than deaths from breast cancer or HIV or traffic accidents. So it is a very serious problem. And not only that, I mean, healthcare professionals that are involved in a serious error, serious accident, are developing as well mental health problems. This is what is called second victims. So it is a very important problem that requires a solution. For sure, solutions, as you are discussing, require structural changes, long-term policies, etc., etc. So the question is, what can be done in the meantime? And technology can alleviate this problem. The question is which type of technology, because I'm sure you have heard about technologies that instead of reducing the stress for professionals are increasing the stress. So they require long training, high level skills. So it is not helping a lot. So what type of technology could be ideal? So in my opinion, it could meet 5 requirements. The first one would be reduce the stress, as we have discussed. Second, increase efficiency for healthcare professionals to manage this work overload. The third one would be minimize the risk of errors, which is, I mean, in this case, especially medication errors. The fourth one, I think it was discussed as well, reduce the bureaucratic work. I mean, surveys are saying that nurses are spending up to 35% of their time in just documenting in the electronic health records what they are doing. I mean, what they have done with patients. And the last one would be to address those areas where professionals are spending more time. For example, in the case of nurses, again, some surveys are indicating that general nurses spend approximately 40% of her or his time in preparing and administrating medication to the patients. So the question is there any technology that meets these 5 requirements? So yeah, the answer is yes. I mean, it's digitalization and automation of the medication management process. So what does it mean? I mean, this means automate all the manual process that are not driving clinical benefits for patients to do it automatically, but as well implement electronic systems along the management process. It is called as well closed loop medication management system. So it means electronic prescription for medication by doctors that nurses and pharmacists are using electronic preparation systems that are helping them step by step on what they have to prepare, and the electronic administration as well. This means the use of barcode readers. Probably you have seen that in the films, not in reality, because I do not see many hospitals using that technology, where a nurse is reading the barcode in the bracelet of the patient, is reading the barcode in the medication, and if everything is okay, the right time, the right patient, the right moment, etc., then nurse is reading the infusion pump, and then the infusion pump starts to administrate medication to the patient because it's disconnected to the electronic prescription system. So the beauty of these systems is that all of them are connected to the electronic health records. So nurses don't need, when they are preparing or administrating medication, they don't need to come back to the system and tell the system, I have done this at this time, etc., because everything is automatically documented. So it is really increasing efficiency, reducing bureaucracy. It is easy to implement. It does not require hard skills. It's very intuitive and minimize as well medication errors, which is one of the main objectives. This technology has been recommended by WHO, OECD, European Association of Hospital Pharmacists, European Health Management Association, etc., etc. It is part of the European health data space. As you know, electronic prescriptions and electronic dispensations are part of the European health data space. Interestingly as well, as you know, Europe's Beating Cancer Plan, one of the items in the program is the creation of a comprehensive cancer center network. And in the standards, the electronic prescription and preparation systems connected to the electronic health records is a requirement for cancer, just to be able to be incorporated to this network. So if this technology is so good, everybody would expect to see this everywhere in European hospitals, but it is not the case. Just as an example, just the barcode readers, what I was mentioning to you, it is implemented in less than 30% of European hospitals. So this is a call for action for European Union and member states to prioritize the investment on digitalization and automation of medication management pathway to alleviate a little bit this workforce crisis in Europe. Thank you.
Thank you very much, José Luis. And I think it's very clear that technology and digital solutions will improve health services, or already improving it, and will further improve it. But then at the same time, as you mentioned, I still remember when we were all told that emailing was going to save us time for other interesting issues, and now we're spending 1 or 2 hours in emailing. So it's a matter of of getting only the right things out, and not too much of it, or a well use of it. So we have lots of questions that were sent to us before this live session. We also have some comments and on live comments on the chat. Some have to do with recognition of the very different determinants of mental health, and at the individual level, at the socioeconomic level, but also at the environmental level, and that includes not only climate change or crime and war and many things that we're suffering, but it also includes other variables that are not usually think of, like art and culture. There is also comments on the need of a universal recognition, not only of the veterinarians, but also veterinarians, technical staff, and paraveterinarians as health providers, and that that recognition that is needed. Some approaches and initiatives that the European Commission has already taken have been mentioned, but there is a specific question probably for both you, Katarzyna and Katerina, on with the upcoming 2024 election, how do you think the agenda to evolve, and what do you think? What do you think is the future for next year and the years to come?
Thank you, Professor Arango. Yeah, I would wish I had a crystal ball to tell you. Of course, it's clear that the health workforce agenda is gaining more ownership. That's for certain, and we are very happy to liaise with various stakeholders at national level, but also organizations representing health workers, and to get their feedback. So it's very useful to have any opportunity to get this feedback. Yeah, I heard a very strong call from Mr. De Rauwe. Yeah, of course, we are very well aware, yes, that we need probably also to rethink the approach. We need to rethink the way we we propose and implement actions at our level, that's for certain. But yeah, I have to stress that, yeah, we are not alone. We are not the institution which has the exclusive mandate on that. We have still the subsidiarity principle, and yeah, we have to make sure that what we do is agreeable to member states. So I think, yeah, this is something very challenging, yeah, to get an agreement on the directions of our actions. So we are really not there alone, and we cannot really steer the process on our own. So yeah, I think that here the outlook is positive in a way that that's clear that the health workforce agenda is super important, and more and more people feel responsible for that. So the outlook is in a way positive, but what kind of new action would be taken at EU level, it's a bit premature to discuss today. But I would also like to complement on to what I said, that here we have also instruments which can be used at national level. So the European Commission put at the disposal of member states Recovery and Resilience Fund to help member states to address the problems related to the crisis. And 43 billion of this fund is used to strengthen the resilience of health systems. And a lot of this allocation is used for example, digitalizations. But we also see investments in health workforce. We also see that member states decided to put a priority to health workforce reforms, to revisit the working conditions and so on. So I think that we should not also forget about the initiatives which are also funded under this instrument. So I think, I think it's good that we share the sense of priority, and this is a priority for so many stakeholders. I think that we are stronger in that way, but unfortunately I cannot tell you what will happen in the new political agenda.
Thank you very much. I think it was a Nobel laureate, Niels Bohr, that said that prediction is very difficult, especially if it's about the future. And so, Katerina, I don't know if you want to say something else.
Sure, I can just add from the European Parliament's perspective. Again, it's hard to predict, and like Katerina, I don't have a crystal ball, but we have seen an increase in mental health conversations, an increase in investment in mental health, which is very positive. And from our perspective, we hope the Commission will take a step forward towards creating a mental health strategy, which will also help with the investment in mental health, as well as a mission on mental health and a direct funding for mental health. And again, at this level, it's worrying to experience difficult negotiations with different political groups. So we are a little bit cautious of the future and of the 2024 elections, especially concerning social issue themes and human rights, where mental health and health itself is included. So again, we are wary of the future, but hopeful that with this ongoing mental health conversation, that we can take a step forward towards protecting mental health of our health workforce.
Okay, excellent. And we also have a question for our veterinary experts. What you think are the risk factors that contribute to the high suicidal rate among veterinarians? Any one of you, Tricia or Spoina or anyone?
How would you like to go?
Yeah. Spoina, do you want to go first, and I can just jump in?
That's fine. So yes, there are several factors. Some of them they have been mentioned already. What we have seen from the FEE surveys that we ran, and Tricia presented also the results before. We see that it's a multifactorial issue. It has to do with expectations when you are entering the profession. It has to do with, we see that many of the people that they commit suicide or that they feel not happy within the profession are young people in particular and females. And this is something that we can understand because the young people, they get into profession with certain expectations, with the anxiety to deliver at a certain level. Sometimes it might be that they're not fully prepared on what they have to deal with. It's a mismatch of expectations and what they see in real practice. And then when it comes to females, of course, we all can understand that the burden of the family, many times it's higher perhaps for the females. So they have to cope with a higher burden overall, and that causes problems. So we have seen also that in certain countries that they implemented a model of work with less hours, like part-time jobs. In the practice, we had a better working, let's say, conditions, and they felt more committed to stay within the profession. While in other countries where we had long hours and perhaps this is also due to shortages of the staff. We face shortages in the veterinary sector very much as well. This is another burden. At a certain time, you have to balance as a person because each one of the doctors or the veterinarians are individuals also, and we have to take care of them. So these are some reflections to consider further about. Tricia, please.
Yeah, I think you covered that very well, Despona. I think the only thing to add is there's a lot of research continuing to take place to really understand, you know, as Despona said, it is very much multifactorial, the elements that are coming into play there. But there's a lot of research going on both in Edinburgh and Glasgow in the UK, as well as in the States and in other universities in Europe, really to try and understand exactly what the factors are, but also looking at that suicide prevention in the veterinary workplaces and looking at that more in depth. There was some specific research that was published in 2010, but we need to build on that. And I think, as I said in the presentation, to also find a single scale that we look at, because that's one of the challenges at the moment, is the research will often look at different measures and different scales, and if we can work together, then I think that will really help us to have the evidence that we really need to know to help that prevention in the future.
Right. Thanks. Yeah, I mean, if there is something clear about suicidality or suicide, is that it is preventable, and and we have seen that in many studies. And look at the ambitious approach that Denmark took and reducing the suicides by half. Of course, that goes well beyond the health system, right? It goes into the education, it goes into the social services, and goes into the justice system and all that. But when you really have an ambitious plan, you can reduce largely and significantly suicidality and complete suicide. And that's actually, I think it's very clear. And that probably is related to some of the questions and when health professionals should ask for help and how to ask for help. And again, I think that message that health professionals are superheroes has been very damaging, because it's like if they don't have to be taken care of, and they don't need services, and when they many times when they realize it's already too late. And and me as a marathon runner, I know that if I run too fast in the first 5 or 10 kilometers, I will never get it to the end. So with pacing yourself, asking for help for other people is very important. I don't know if anyone wants to comment on this. Jean-Pierre, Paul, anyone?
The main problem is the stigmatization of mental health. And we have to fight against it. And people have to be aware that if they are going to search for help, they can find it without any problem behind, and they can have this help and not suffering from the help that they are getting.
Right. And I guess that same will apply, right, to the Paul, you were going to say something? You need to unmute yourself.
I just wanted to say it's one component I want to stress. Today, we have the evidence that in all member states, nurses are confronted with huge levels of violence. So nurses are getting beaten up while doing their job. And so violence, the Commission should work out a program for all member states to combat violence against nurses, because in all member states, we have the evidence that there is huge level of violence. Now, if you, Celso, if you get beaten up in your job, would you stay in your job?
Yeah. Well, the answer is not. You know, I would be less likely. But if you ask me personally, the answer is yes, because that has happened to me, and I'm still here. But I understand that not everyone is the same.
But I think that there is a physical violence, but also there is the online violence.
Right.
The harassment with
correct
mails and something like that.
Yeah.
Which is also fantastically important.
Yeah, but I think the point by Paul is very relevant. We were talking about self-harm and suicidality, but there is also another component, which is a heteroaggressivity and like violence against health professionals.
And this has to see with the shortage of nurses, because if in emergency room or ICU, 10 nurses left the profession, the patients and the family are more nervous. They want to be treated immediately. So they are becoming very aggressive. For me, it is not online violence. It is violence in the workplace, really getting beaten up. This is our problem. Okay, it's nice to have programs on virtual violence and all these kind of things, but we can still put off our mobile phone. But beaten up in the unit, this is not normal. And we should act immediately with EU legislation.
Yeah, fully agree. So we're about to finish. Let me ask a very short question, and I hope you have a very short answer. Jose Luis, this is for you. Can you give us 2 very short examples in 1 minute, and how can technology support healthcare professionals? And when I say healthcare, that's veterinarians, that doctors and nurses and everyone to reduce the burnout.
Mm-hmm. Well, there are many. I mean, I was mentioning in the medication management process, I mean, all the digitalization and automation of this process can reduce, again, the burnout, or the bureaucratic process can reduce as well, can increase efficiency, can reduce errors. Again, I mean, many healthcare professionals that have been involved in an error, whatever is the nature of the error, medication or any other type of error, are suffering burnout as well. Mental health problems are the second victim. So, I mean, in the medication management process, digitalization and automation could reduce this burnout. I mean, and there are a lot of clinical evidence, and there are a lot of good examples. But there are more. For example, when you think about screening programs in cancer, there are technology, self-collection sampling, or self-collection samples. I mean, for example, in HPV. I mean, one of the main limitations for implementing HPV screening programs in countries is the cost and the need of having resources, taking the samples for women and then delivering it to the labs to be analyzed. Now they are self-collecting samples. I mean, now there are even one for urine. So if countries can use this technology, they would not need an army of people in the primary care centers taking samples. I mean, women can take samples by themselves, delivering it through mail, and then getting the results. So these are the type of technologies that can drive value and can reduce the burden and especially improve patient outcomes as well, which is critical. But these are 2 examples. There are many, but the digitalization and automation in the medication management process have a clear payback, and there is a lot of clinical evidence around that.
Right. Thank you very much. And I think it is clear from everything we have heard today that there is a window of opportunity that has been opened very recently. And we all, as professional in different segments, should take take advantage of that. And we know that windows are not always open. This time it's open, and everyone is concerned. Everyone is interested. Everyone is preoccupied on mental health issues, and that is something that we, as a community, should take advantage of and make sure that it ends up with solutions, because this is something that does not affect us as professional. It really affects the whole population, and it really affects any citizen in Europe. And again, the prevalence, the incidence, the impact, the economical impact, the suffering, and everything makes it very clear that this is a common problem, and it's it's a public health issue. And with that, and I don't want to finish without thanking all the speakers, all the panelists, all the audience, but also the people behind the scenes and the people that make this possible. Elisa Corritore and Giulia Nicolini from the Federation of European Academies of Medicine, that all together with the Federation of Veterinarians of Europe put together this very interesting forum workshop that probably adds a small piece of evidence that what we're talking about is very relevant. And I would like to finish by thanking you all, and remember, all of you and myself, that there is no health without mental health. Thank you very much. Bye now.
Thank you.
Bye-bye. Thank you very
Bye.
much.
Thank
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Good luck.
You too.